Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines, or to find a location near you, visit Vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hello, everyone. It's September the 8th on Wednesday. We've lost another 21 people in West Virginia. And, thankfully, we did get a little uptick in the total number of people that got vaccinated over the last few days. But nevertheless, we've still got a long ways to go there. I've told you over and over and over that the only way in the world, the only weapon that we have to fight back with is the vaccinations. And I've also told you as far as wearing masks and having masks on, out, when you're in a crowded situation, especially if you're 65 and older, it's a good thing to do. It's not the end-all, do-all, we know that. But with that, it can't hurt, and so I ask you again to pay your respects, and if you know any of these people, call them on the phone or go see them. If you don't, just please keep them in your prayers. But we're up to 3,169 total deaths in the state of West Virginia right now. So with all due respect, let me read through these, but our 3,149th death is a 65-year-old male from Harrison County. Our 3,150th death, a 44-year-old male from Logan County. Our 3,151st death, a 66-year-old female from Kanawha County. Our 3,152nd death, a 67-year-old female from Berkeley County. Our 3,153rd death, a 46-year-old male from Lewis County. Our 3,154th death, a 57-year-old female from Summers County. Our 3,155th death, a 79-year-old female from Putnam County. Our 3,156th death, an 83-year-old male from Grant County. Our 3,157th death, a 102-year-old male from Kanawha County. Our 3,158th death, an 80-year-old male from Berkeley County. Our 3,159th death is a 73-year-old male from Braxton County. Our 3,160th death is a 62-year-old male from Cabell County. Our 3,161st death is a 79-year-old male from Cabell County. Our 3,162nd death is a 66-year-old male from Clay County. Our 3,163rd death is an 86-year-old male from Berkeley County. Our 3,165th death is a 72-year-old male from Kanawha County. Our 3,166th death is a 69-year-old female from Fayette County. Our 3,167th death is a 59-year-old female from Cabell County. Our 3,168th death is a 71-year-old female from Taylor County. And our 3,169th death in West Virginia is a 61-year-old female from Logan County. The only way we're going to be able to stop this is the vaccinations. We have 1,352, positive cases since our last update. Our daily positivity rate, get this, is at 17.96%. Our cumulative percent positive is at 5.38. We have 22,215 active cases in West Virginia. We have 813 people hospitalized, and we're at an all-time record in the ICU units of 252 people. All-time record high of patients on a ventilator, 132. For the most part, our whole state is red and orange. We have 68 county outbreaks at our schools. 68 school outbreaks in 31 counties. 10 schools and one entire county, Clay, are closed due to COVID. 29 counties have initiated, out of our 55, have initiated mask mandates, from K through 12. Our hospitals are still overwhelmingly inundated with cases of people that are not vaccinated. I hate to tell you this, but from the acceleration rate, West Virginia leads the nation in an acceleration rate of new cases. You'll hear more about that from Dr. Marsh in just a few minutes. From the standpoint of reminders, 65 and older, again, I remind you over and over, if you have any symptoms at all, go get a test. The antibodies are waiting on you. They can save your life. People are dying and they're continuing to die, and absolutely that could save your life. Get a test. Just get a test. I encourage you about wearing face coverings in big crowds, especially if you're over the age of 60 or 65. Pfizer has been fully approved by the FDA. I've told you that 14 times. You know, from the standpoint of our booster shots, we stand ready to go. I don't have a clue in the world what's going on with the Biden administration. We have tried every angle that we can possibly try to be able to get booster shots to the 60 and olders that are out 6 months or whatever it may be. We've got a bunch of those folks, and we need to get those shots in their arms right now. But with all that being said, we cannot get the Biden administration to move. Like I said, West Virginia, we have done well. We have led the nation in many, many categories in regard to these vaccines. You know, and absolutely that's why we need, the whole key is we need now to be able to move forward with the booster shots, but we cannot get approval to move forward. We're going to continue to try. We've given out 11,000 doses since last Friday. It sounds great, doesn't it? But absolutely it's not enough. It's nowhere close to enough. We've still got so many folks out there that we could get across the finish line. We're at 92% of the 65 and older. That's great. We're at 86% of the one dose of the 50 and older. It's great. But how then can everything drop all the way down to 73%? We've got a lot of folks that are not vaccinated, that are in the younger categories, and we need to get them vaccinated right now. We're going to go back on the road again tomorrow, doing stuff with our young people primarily and everything. We're giving away a lot of wonderful, wonderful prizes and everything, and to do it for Baby Dog Round 2. And I'll promise you those folks, you know, will be happy and we'll get big smiles on their faces and everything. And all that's great. And we're doing all this with stimulus dollars coming from the federal government. And you know, we are absolutely trying to encourage each and every day. We're making progress. Not, you know, we won't deny the progress. 11,000 people since last Friday. How many lives have we saved? We saved a bunch, but we still could stop this if we could just get people through the wickets and absolutely to where we could get them to take the vaccines. No point in me reading through this, but their age eligibility, 12 and older, you know, the natural immunities are very questionable whether or not they're going to be as good as the vaccine or not, but the vaccine cannot hurt you, for crying out loud. Why not take the vaccine? Young people are the issue. The COVID information's up there. All the free testing stuff is up there. We thank Frith. We thank Walgreens over and over. Long-term care facilities, we now have 62 outbreaks. 3 in our churches in Barber, Monroe, and Wayne counties. Our corrections, we're up to 134 inmates and 58 staff. I encourage you about giving blood all the time. Our grand families announcement was up. The registration is open. Please, grand families, help us get the kids in your households vaccinated and take advantage of this $150 voucher. Now, a couple of really nice announcements here is we know who our Teacher of the Year is. His name's Brian Casto, and Brian is from Cabell County. He and Kathleen Miller is our service personnel person of the year, and she is from Wayne County. I congratulate them both in every way. Brian is a teacher of West Virginia Studies at Milton Middle School in Cabell County, and he also coaches t-ball, and he works with the teens in his church. He enjoys the outdoors with his wife and 3 children, and we congratulate him on a fabulous job. And Catherine, I'm sorry, I may have said Kathleen, but it's Catherine. Catherine Miller is the state's Service Personnel of the Year winner, and she is a cafeteria manager at Wayne High School. She's done it for 19 years. Her students and everybody just love her to death. She makes incredible contributions to us all across everywhere. She has participated and helped with fundraisers for hospice in Huntington, and is also involved in the Wayne County Special Olympics. And Catherine, just what incredible work both of you do. You're both very, very deserving. Again, I congratulate all the finalists, that were involved this year. We got a lot of great teachers and service personnel folks that do incredible work across this state with our kids, and even as we speak, do they not deserve all kinds of badges of courage, because they are running to the fire right now so that our kids can be in school. Absolutely, they are there with those kids and everything right now to assure that our kids can be in school and get in-person learning. It's so important. And we hate it like crazy with what's going on with this pandemic and raging in Clay County right now. We got a lot of folks probably in Clay County that need to get vaccinated, and absolutely, without any question, we need to be able to get our kids back in school. Today is Heroes Day, and our Saturday will be, the official declaring on Saturday of West Virginia Heroes Day. We try to do it and let it coincide with 9/11, and so this year it just so happens that it is coinciding right to the very day, and so 20-year anniversary of an event that none of us will ever forget. And so as we salute all those heroes in every way, all across our state, all those folks that ran to the fire, all those from the firemen to the policemen to the first responders to the grocery store workers that I say over and over, but we love them, we thank them. There's a special celebration going on at the Ritchie County 4-H grounds just outside of Harrisville, and if you want to stop by there, but all the doctors and nurses, everybody, all the healthcare people and everything that have done amazing work through this, please remember them on this day. Please remember them every day, but especially remember them on this day. A day when, we had an attack on this country, and so many were perished, and so many ran to the fire there and everything and trying to save lives. So many have perished in West Virginia now, and so many have continued to run to the fire. Remember them all, in every way. Those that we've lost and those that are currently with us and everything, and trying to help each and every one of us each and every day. So that's all I got right now. I need you to get vaccinated in every way.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I think the governor's really covered very well what the situation is. And just as a quick reminder, we've been talking for probably the last 6 weeks or more about the effect of the Delta variant in other places, and comparing what happened in India, which was a very much unvaccinated country, versus what happened in the United Kingdom, which was a much more highly vaccinated country. That in India, we saw an explosive growth in the number of cases that was generated by the Delta variant, because the Delta variant is much more highly infectious and was spread to people. Hospitalizations explosively grew, and to the point where people, families need to bring their own oxygen for their family member who is lucky enough to find a bed, and deaths went up extraordinarily. They saw between 400,000 and perhaps as many as 3 to 5 million deaths during that time that the Delta variant ravaged India, which was about a 10 to 12 week period of time. The United Kingdom, on the other hand, saw a real explosive increase in number of cases, but saw much fewer hospitalizations and really no deaths that increased. And that probably has to do with the immunization in their population and perhaps the health of their population. But fundamentally, we saw two different aspects of the Delta variant. And what we're seeing here in West Virginia right now is exactly what we would expect. The Delta variant has entered that explosive growth phase where enough people who are unvaccinated are infected, that they can infect other people that are largely unvaccinated in social networks, and you're getting cross-contamination. And just like if you have a big roaring fire, the fire might start off in a few places, but after a while, if you have enough dry timber and have too few number of firewalls, that fire can start to consume more and more of the forest at risk and start to join and create one raging fire. And that's exactly, I believe, what we're experiencing right now in West Virginia. As the governor said, the way to generate the firewalls is vaccination. And there's really no other intervention that works as well as that. And so we are very much hoping that West Virginians continue to choose vaccination of the vaccine eligible, because what we see is that vaccines are incredibly protective. Even as we look at more people who may be suffering some vaccine breakthrough cases, an article recently written, looked across all of the studies, and the risk of even getting a vaccine breakthrough in the United States is about 1 in 5,000 people. And as we look at West Virginia, we see that certainly the more severely ill people who are in our hospital beds, in our ICU beds, and on ventilators are people that are not vaccinated. And for people that do have vaccine breakthrough cases, these are almost all older West Virginians with pre-existing medical problems. And as the governor said, if you fall into that category, if you're over 60, 65, 70 years old, and you're fully vaccinated, and you are 6 months or so from your final vaccine, then be careful right now. It's a time that you could be at risk, although the vaccine that you've received should still be highly protective for you. And if you're unvaccinated, be incredibly safe right now, and please choose vaccination. Vaccination won't get us out of this surge right now. It has already started, and it will need to consume itself out in that inverted V-shaped curve that we've talked about before. But as the governor also pointed out, we are basically at the peak of our hospitalizations that we saw in December, January, before we had the vaccines. We now have more people in the ICUs, more people in ventilators than we've ever had before, and this is still growing. And this really demonstrates the impact and the severe illness that people that are not vaccinated can get from this Delta variant. So as this variant continues to burn itself out, and we predict it may take as much as another 5 to 7 to maybe as many as 10 to 14 days for that to happen, although we have been surprised before. And so we are waiting watchfully as that goes forward. We also know that our hospitals are being stressed in ways that they haven't been stressed before. And we are working very closely hand in glove with our hospital leadership and our long-term care leadership to fashion plans to be able to continue to maintain the capacity for that. As the governor said, our two main jobs are save lives and protect hospital capacity. And this Delta variant is going to challenge us in a way we haven't been challenged before on both. The way that we get out of this is people be careful, wear masks if you're indoors, please be fully vaccinated. That is by far the most important consideration, and stay together, because together we are much stronger than if we fracture apart. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. just to reinforce a couple of points that the governor and Dr. Marsh made, we continue to see an uptake in vaccines. Excuse me, but as the governor points out, it is just not fast enough. The speed is just not fast enough. We've got to continue to educate West Virginians. We've got to continue to get West Virginians to go out and get vaccinated. But as Dr. Marsh pointed out, we will not get through this surge with those vaccination efforts, but we've got to be prepared for what comes next. Just reinforcing why that is so important, as was pointed out, we are at basically the peak and beyond of our hospital numbers that we saw during the last surge. We are working, as Dr. Marsh pointed out, with the Hospital Association and the individual hospitals to manage equipment such as ventilators, to work through challenges that they face. All of our hospitals told us this morning that were on the call that they are now managing throughput challenges to make sure that they have space, primarily based on staffing issues and equipment issues, to be able to address the needs of West Virginians. And Jordan, if you could, if we have that donut chart. So just to reinforce again, the governor's point, Clay's point, all of us about vaccines. If you look at these numbers right now and you look across those various charts, total hospitalizations, COVID hospitalizations, 83% of those people are unvaccinated. 17 are breakthrough challenges. But when you dive down into the numbers specifically of the most ill, ICU, 90% of those folks are unvaccinated West Virginians. Only 10% are breakthroughs. And 92% of the ventilator patients are unvaccinated. So again, to reinforce the point, West Virginia, we wouldn't be here. The governor wouldn't be coming on 3 days a week. We wouldn't be reinforcing this if it wasn't the right thing for you to do to protect yourself, as well as to protect the rest of West Virginians, so that we don't run into challenges where an individual who is ill for some other reason can't get hospital care because unvaccinated West Virginians have taken up our hospital spaces. Thank you.
All right, thank you, sir. Dr. Ainamjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hello there. Sorry about that. I had a hard time unmuting the microphone. Welcome back to the briefing, Dr. Marsh. I hope the nuptials went well with you and your family. I have a couple of questions for people who've emailed me, and I had not addressed them, and I haven't heard them addressed. So I'm hopeful maybe Dr. Marsh can set us straight on them. One said, keeping in mind the importance of vaccines, are there treatment modalities that are being used, that are being tested for future treatments? Something like Tamiflu for the flu. Is there a push to make any treatments available like that down the road? Have you heard anything? And the second question that I have is, when a person receives a positive COVID-19 diagnosis, is there a standard protocol treatment? What are the available treatments? Is everyone offered the monoclonal antibody infusions, or does it depend on the severity of your symptoms? Thank you very much.
Dr. Marsh, go.
Thank you, Kenny, and thank you, Governor. So to answer your first question, Kenny, yes, many companies are working on different approaches, antiviral agents that could be used as a preventive measure to try to keep the virus from entering the body. But let's just point out, and this is really important, that we already have an incredibly effective treatment, and those are our vaccines. The mRNA vaccines are really remarkably, almost miraculously effective at protecting people from COVID-19 infections, and certainly protective against severe infection, hospitalization, ICU admission, and death. So ultimately, we have a tremendous treatment. We're just not able to have enough people choose to receive it. When it comes to standard protocols for people who are infected, certainly we would advise for everybody who's infected or has symptoms to get tested. That way we can start to isolate people who do have COVID-19 infections from others, which slows down this explosive rate of growth. Certainly people that are qualifying as immunocompromised, people who are over 65 or who have other pre-existing health conditions can be candidates for the monoclonal antibody cocktail that we have, and those can be life-saving, and they work only as outpatients as opposed to people that get sick enough to go to the hospital. So getting that treatment to people quickly is certainly important, but there are criteria for the use of those treatments that are available, both through the DHHR, through the Bureau of Public Health, Dr. Amjad, and others. We also know that use of an inhaler, a steroid inhaler, might reduce some of the lung problems in people who are having any problems breathing, particularly people who may have other pre-existing lung problems. When people get in the hospital, the treatments change. Remdesivir, which is an antiviral agent, is used. And if people have respiratory problems, then the steroid dexamethasone is used. There are also other really targeted treatments against the over-response of the immune system that can be used in specific instances to be able to reduce the time that people are in the ICU or on a mechanical ventilator. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. You said we were probably going to reach the apex of our peak in 5 to 7 or 10 to 14 days, so somewhere between a week and 2 weeks. Could you give us an idea of what you expect to happen after that, after we reach the top of that peak? What are we going to see over the next few weeks? What's the drop going to look like? Thank you.
Dr. Marsh, go.
Thank you, Governor. Thank you, Charles. So what happens in other places, Charles, is that although the cases tend to asymptote go over the peak, the perpetuation of people getting sick seems to be prolonged. So in the United Kingdom, for instance, they didn't see nearly the hospitalizations and certainly saw no change in deaths during that peak. But when they finished that peak, they started to see more hospitalizations and more deaths. And part of that certainly might come from the loosening of some of the restrictions that happened in the United Kingdom during that time. But we can anticipate, even if everything gets much better and we get many more people vaccinated, which we're certainly hopeful to do, that we'll still see a potentiation for at least 10 to 14 days of numbers of people in the hospital and people who may well die of COVID-19, because both of those tend to be lagging after the peak in number of cases.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I wanted to ask a question about rural hospitals. At this point in the pandemic, many of those who were vaccinated on staff at rural hospitals are near the end, and kind of like in your boat, Governor, where the efficacy has gone down a little bit. That also would put the stress on the rural hospitals, I think that General Hoyer alluded to in his comments, where you might not have enough staff to treat the people. Is there a plan in place to take care of a rural hospital that may get into that worst case scenario? Or maybe if there would be more than one of them, and maybe the instant follow-up is there anybody on that teeter-totter there that they may be in trouble, and we haven't really seen that yet? Thank you.
Paul, there is a plan, and there's, the overflow plan is in place, but General Hoyer, maybe you could explain more about this.
Yeah, Paul, so the first phase of this with the hospitals is the hospitals individually will have to manage the availability of other care that they can give, primarily looking at elective procedures and processes. So they'll manage that. then that is also managed for our primary facilities, because you'll start to see a challenge with the inability to move patients out of critical access hospitals. So all that has to be managed, and we're now managing it at each hospital level. And then from there, we look at the larger state plan to be able to address additional overflow. But it all primarily goes back to your point, staffing availability right now. And that's the challenge that is the hardest to manage.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, cabinet members and COVID team. I'm specifically wondering about young people. I'm hearing anecdotally, for example, Ohio County had 150 new positive cases last week. 50 of those were people under the age of 18. I'm wondering if we have any statewide numbers or percentages in what's being done specifically to address the apparent surge in disproportional positive cases of people under the age of 18.
Dr. Amjad, maybe you can help us with this one.
Yes, Governor. Mark, we do have, I'm going to pull up my numbers here, but we do have a lot of cases who are less than 18. I mean, they're about 1,200 to 1,000 over the last 7-day average. So, I mean, you're right. We're not seeing a lot of young people getting the vaccine like we thought we would. When Pfizer initially came out, we did see a little bit of an uptick before the summertime with people wanting their children vaccinated. And we thought, you know, with the summertime coming and vacations coming, people would want their children vaccinated. Then we saw it kind of go down. So we do want people to get their children vaccinated, but it's been close to 800 to even 1,200 range for that younger generation that you're talking about. We have been trying to do messaging campaigns through different commercials, billboards, through the health departments, through school campaigns. We still offer vaccine clinics through families and friends. You probably saw the grandparent messaging that General Hoyer did with grand families and kids and that type of thing. We still offer it through sports and sports families. So we're trying our best to get the message out there, but it's still, you know, very hard for people to want to do that. But if you can get that out there as well, we'd appreciate it. Thanks.
All right, thank you, Mark. Next to June Leffler with West Virginia Public Broadcasting.
Hello. Good morning, panel. This question is for the governor. So, Governor, you've mentioned that you're not interested in a mask mandate, or you're holding off on it until absolutely necessary because of a possible fragmentation. And I was just wondering if you could expound on that a little bit more. You know, in your mind, does that look like, you know, neighbors being at odds with each other, or debates in school boards? Or does it even look like, you know, possible harassment of, you know, public officials? And, you know, that might sound like a little bit much, but I'm thinking back to the governor of my home state in Kentucky. And I remember him, you know, seeing an effigy of himself outside of the governor's mansion. And, you know, it is a possibility. So I'm just wondering what your concerns look like as far as this fragmentation.
Well, June, and I don't want to sound like a tough guy, but June, I'm not going to be afraid of anybody. I mean, under any circumstance, I'm not going to be afraid of anybody. I'm going to try to, with all in me, to make the very best decision for everybody, and that's what I'm trying to do. It's not that I am opposed to a mask mandate or whatever. I'm opposed to mandates. But in this, I am trying with all in me to keep us together, because I know the very second that we start to fragment and we start to run in all kinds of different directions, we'll get worse. It won't get better. It'll get worse. You know, today in this country, there's 650,000 people that have died. And in West Virginia, we've got a little over 3,000. You know, 3,000 is astronomical. 3,169 people is just terrible. It's beyond belief terrible. But some way, somehow, God above has blessed us in the fact that we still, even though it's bad, we still kind of hang in there and hang together. Now, I would tell you just this, June, that every day that goes by with no playbook, everybody is working to try to figure out what is the best thing to do. Kenny Bass sent me a text the other day, and he said, "Governor, you look terrible." I've probably had people say that before, but Governor, you look like you're just worn out, and Governor, you don't look good and everything. Well, I don't feel good. It's hard to sleep. It's hard to sleep when you're worried. You're worried about everybody. You're worried about what's going on. You're worried about the hard-headedness of people that are refusing to take the vaccines. Yeah, it does wear on you. But from the standpoint, June, of being concerned about, what people are going to do or what people did to the Kentucky governor or what people, how people may get all riled up and everything, that doesn't affect me. That does not matter to me at all. I want to do what's the right thing, and that's what I'm going to do. The very, very best thing that I can do for everybody, not just a specific group, everybody. And that's what we're trying to do. And I'm going to tell you, it's tough stuff, but we're hanging in there. And if West Virginians will just stay together, and we will take heed to the fact that nearly 90% of our cases, right at 90% of our cases of people that are hospitalized are unvaccinated. For God's sakes of living, how difficult is this to understand? Why in the world do we have to come up with these crazy ideas? And they're crazy ideas that the vaccine's got something in it and it's tracing people wherever they go. And the same very people that are saying that are carrying their cell phones around. I mean, come on. Everything is right in front of us. Everything is right dead in front of us, exactly what we should be doing. And we just need to use good sense and get ourselves vaccinated, and then we'll stop this thing. I hope and pray Dr. Marsh is right, that this surge, may very well last another, 7, 10, 14 days. The problem with that is he doesn't know. None of us know. And really and truly, if that 14 days turns into 10 weeks, just think of the numbers that are going to die. So, no, June, I'm not concerned. I'm not concerned about somebody throwing a rock at me. I'm concerned about people throwing rocks at all of us and hurting all West Virginians. But I'm not concerned about me.
Thank you, June. Governor, I'll turn it back to you.
Well, the only other thing I could add is just this. When you've got a good general and he's saying 650,000 people have died in this country, and right at 90%, a little less than 90%, I think it's 87% of the people that are hospitalized in West Virginia are unvaccinated. Look, we all know that there's no end-all, do-all. There's nothing perfect here. But we all know, odds-wise, we have to play the very best odds that we can play in life in everything we do just about. With all that, if you get vaccinated, it is absolutely painless, and it is incredibly safe and unbelievably protective. Now, I did this in a State of the State one time. I said, it used to be the old horror movies were all centered around, a lot of them centered around Frankenstein. And Frankenstein was the monster that was created. And Frankenstein went through killing people. And he walked, he had his arms out, and he just boom, boom, boom. And I used to think, Anybody that gets caught by Frankenstein deserves to die. Well, if you're not vaccinated, are you falling into the Frankenstein syndrome? Really and truly, with all the information right in front of you and knowing how important it is for you to get vaccinated, not only for yourself, your family, your neighbors, and everybody around you, please don't fall into that scenario. No one deserves a bad outcome. No one. But absolutely, we have got to be able to protect and look after ourselves. When it really boils right down to it, you'll never forget the guy below the dam that I've said many times. The water coming up. The park ranger goes there. And he says, no, I'm going to stay right here. The good Lord's going to take care of me. Then the next thing that happens is people go in a rescue boat to try to get him because the water's come up that high. No, I'm not going anywhere. The Lord's going to take care of me. The next thing is the helicopter flies in and he's sitting on his roof and the water is all the way up on the roof of the house. I'm not going anywhere. The good Lord's going to take care of me. Well, the bottom line is the man drowns. And as he's going through the pearly gates of heaven and he's standing there, he says, Lord, I can't believe. I knew you were going to take care of me. What in the world happened here? Why in the world did I drown and everything? I knew you were going to take care of me and everything. And the Lord looked right back at him and said, I tried 3 times. I sent the park ranger, I sent the boat, and I sent the helicopter. You got to do something for yourself. He expects all of us to do something for ourselves. He's so great, it's unbelievable. But we have got to get ourselves vaccinated. Yeah, Kenny, I look bad probably. And that's probably the way it's always been. But I really care. I really love our people. And I hate like crazy to see over and over more and more and more of our people die and get sick and maybe have side effects forever, or children exposed and everything. I hate it. And I want it to end so badly. And yeah, I really do care. And yeah, it is taking a toll. But it's going to be okay. We're going to get through it. Thank y'all a bunch.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, Visit Vaccinate.wv.gov.